Um, we need economic stimulus in any case, and if you lay off a teacher, you've not only devastated uh, the future of that teacher's students, you've also undercut our ability to have that teacher out, able to pay the rent to the landlord we just had earlier, able to buy things, able to get takeout food, and when Dr. Goldman says it's okay, able to sit at every other table in a restaurant. So we need to to keep the economy together. We need to move it forward, and the best way to do that is to make sure the teachers, cops, public health workers at the local level, et cetera, are not laid off, and that the programs that they put together continue. So this has been the biggest fight between Democrats and Republicans. It's the thing most likely. I wish we could pass a bill this week, but this is a fight where the battle lines are being drawn. I hope more people from more states make it plain that McConnell's idea that states should declare bankruptcy, my God, the effect that would have on the economy of this country, not only one state goes bankrupt, all of a sudden their retired police officers aren't getting pensions. It's terrible for that state, but the effect it would have, I chair the subcommittee that deals with Wall Street and the stock market. The effect that would have on the stock and bond markets would make 2008 look like a tea party. So we cannot let our states go bankrupt. We need to replace the revenues that they're not able to collect. And this is especially important for California, which is very dependent upon the capital gains tax when you sell a property or especially a stock at a profit. Not a lot of people are selling stocks at profits right now. With that, we have the answer to the second question, and the results are fairly similar to the first question. The question was hazard pay paid for with federal money. Yes, 76%. No, 11%. Undecided, 13%. Let's go on to one more question, and then I'm going to have Christy, are you still on? I don't know if we have a question that relates to the state government. I know the Assemblywoman was going to have to leave us before the end of the town hall, so let's go on to one more question, and then I will have a few questions for Dr. Goldman.
We have Ira from Sherman Oaks who has a question also for Dr. Goldman.
Oh.
Hi, Dr. Goldman. My question has to do with the mutant virus that seems to be more infective than the originally found one, and what effect will that have on vaccine development?
Well, so far, actually, the changes that have been seen in the virus as it transmits, the viruses make little tiny copying errors, have not made them more dangerous because the original one is just about as dangerous as they get. But that is something that you do have to watch when you develop a vaccine. And that is that you want to make sure that as the virus might change over time, that the vaccine is staying effective. So there are two things that I think are really important that will help us. One is that we have never had a vaccine kind of modeled on the basic premise of actually killing a virus from this family, a coronavirus. And so once we're able to invent a coronavirus vaccine that kills any coronavirus, modifying it as the virus modifies is going to be a lot less work than inventing it in the first place. So you know how every year we have a different flu vaccine because we know how to go after that basic architecture of a flu virus And then when it has small changes year to year, we can change the vaccine and modify it and go after it. But we have never had a vaccine that actually goes after the basic architecture of a coronavirus. And so, but that is something that will have to be watched. And the two things that we will have to watch year to year is the virus changing? If we're not able to wipe it out completely, which is possible. Remember, we've wiped out smallpox, and we've nearly wiped out polio, and so it's possible with vaccination to completely eradicate a virus, and maybe we can do that before it's sneaky enough to change itself. But the other thing we can test is the immunity in the population. And you hear this word used a lot, herd immunity. Where we will see herd immunity is when enough of us are vaccinated effectively that the virus just can't transmit itself very well, like what we're able to do today with measles, with children by giving the measles vaccine. That is what we can look at by actually measuring the antibodies in people's blood to see if we're getting effective levels of it against the virus that's circulating. So we'll be able to monitor that, but we will have to monitor that because you're right. I mean, these viruses can change. But again, it hasn't changed yet in a way that makes it worse. But, it's already pretty bad. So.
Doctor, I'd like to follow that up. The articles I read said maybe these changes aren't going to make the disease more immune from a vaccine, may not make the disease more deadly, but may cause it to be more infectious. Is there a risk that the virus or there's always a risk. Is the virus getting more infectious? It's already started out pretty infectious.
Yeah, we don't have evidence that it's actually getting more infective, but as you say, it's already pretty infective. So one problem that we have is that with the limited amount of testing, what we observe with testing is what I would say is the tip of the iceberg. We clearly know who has symptoms, who has been in the hospital, and who has died, although we might have lost track of some of those where we've had huge numbers all at once, like in New York and in Italy. So, but still, we can see the tip of the iceberg. But now as we're getting more testing, we're starting to see the people who are carrying the virus who have only mild symptoms and maybe no symptoms. And there's less and less of that iceberg that's under the water. But, it's been confusing. We try to compare the rates in different countries, and where different countries have had different amounts of testing. In some countries like Germany, they can see all of these cases, even mild cases and cases with hardly any symptoms. And then when we look in the U.S. and in the U.K. and other countries that haven't had much testing, we only see the more severe cases. And so why that's important, we're getting a better sense of even how infective it is. I mean, where the tags have been helpful, though, is those little mutations in the virus have helped us to see where the different outbreaks have come from. And the fact that the outbreak in New York, which has been so horrible, largely came not directly from China, but to New York through Europe. And so we stopped the travel from China, but we were still allowing the European travel. And that's probably what allowed the New York epidemic to accelerate as fast as it did.
Doctor, I'd like to explain, and then you'll correct me if I'm wrong, two related things, one of which is the R factor, and the other is herd immunity. The R factor is, for each person who gets it, how many are they likely to infect? And that depends upon the makeup of the virus, how contagious it is, and the behavior of people. So if the R was, say, 2, then if 10 people are infected, they're going to be, before they recover, they're going to infect 20. If the R factor is 3, they're going to infect 30. And if you can bring that number down to less than 1, so if there are 10 people who have it, before they recover, they're going to infect 9, then you see the disease is on its way out. there are a few ways to reduce that R and get it below 1.0. One of those is to adopt the social distancing. That is obviously very expensive. It has cost us over $3 trillion and many Dodger games. A second way to do that is to generate herd immunity, so that even if you're living a lifestyle where if 10 people are infected, they're going to expose 30 people to the disease. If most of those people are immune, then 10 coming close to 30 only infects 6. And those, so you've gone from 10 infected people to 6 infected people, and you're moving the disease down. That herd immunity can come in 2 ways. One of those is we develop a vaccine. Not everybody's going to take the vaccine. Well, hopefully we'll get up. Certainly worldwide, we're not going to get 100%. But if we can get 60, 70, 80% vaccinated, then you've got that herd immunity, so that even if somebody does get it, they're passing it on to less than 1.0 persons on average. The other way to do it is we all go is we eliminate social distancing. This disease sweeps through. It kills lots of Americans. It exposes 60, 70% of Americans, and then you have herd immunity, at least for a while. That is not the approach that we want to take, because this disease is deadly. How deadly it is we can't really calculate, because we haven't had enough tests to use them for statistical purposes. What we need, and Dr. Goldman and I were talking about this yesterday, is to have 3,000 tests or a lot more, where we say we don't need these tests to tell Mary or Jack whether they have the disease, whether they should. We're just going to use these for statistical purposes and randomly test 3,000 people around the country. If we did that, we'd know what percentage of Americans have been affected. The best numbers I've seen, Doctor, you may have others, is that maybe, and this is very different between Chelsea, Massachusetts, and Boise, Idaho, but that maybe 3, 4, 5% of the country has been affected by this disease, many with mild or no symptoms. So it's hard to calculate how deadly this disease is. We know that unfortunately 70,000 Americans have died. What we don't know is whether 700,000 Americans or 7 million Americans or 17 million Americans have contracted the virus. So we don't know if it kills 1 out of 10 or 1 out of 100 or 1 out of an even smaller, an even larger number. So we don't know how deadly this disease is, but we know it's deadly enough that we do not want to let it run through our society. Doctor, I wonder if you have any quick comments on that, and then we'll go on to the next question.
Well, first and foremost, I feel like I ought to be giving you an honorary degree in epidemiology, because that was a great explanation. And it's just amazing to me that now people are learning epidemiology the way I'm always trying to struggle to learn economics, for the other part of my life. But I think that, you're right that we don't want to go there through trying to get to herd immunity because of all the people who will be hurt by that, including, many young people. There's a misunderstanding of probability. Just because you're more likely to get seriously ill if you're older when you have this doesn't mean that there's a zero likelihood of getting very, very sick or even dying when you're young. And we've seen plenty of young people suffer terribly from this thing. But, where we know a lot about the amount of disease in the population, which has been in Germany, the rate of death has been far lower, a fraction of a percentage point, 0.25%, instead of like in a place like the UK where it's 4%. So the rate of death is still high. That's still higher than what we'd like to see with a respiratory infection. I mean, what I say is that we're just starting, the CDC and others, to do these surveys called prevalence surveys that will look at immunity, and that will help. The seroprevalence surveys, which will look at the antibodies in our blood, and they'll give us a clue of how much of this we've been exposed to. What we don't know yet is how protective those antibodies are. Will they stop us from getting the disease again? We don't know. Like I said, the disease has only been in humans since November, so we've got to learn that. And then also how long they'll last. If you can get high enough levels that they're protective, how long is that protection? And for some other coronaviruses, it's only 1 or 2 years. And so Dr. Fauci and others have been saying, we shouldn't count on it being for a very long time. But it would still be helpful if it really were true that we were getting some immunity that way. So I think that is so, on the road. In the meanwhile, I mean, you can affect R by staying at home, but also, even wearing a cloth mask brings down your R because you're not spraying droplets into the air around people, and not attending large events once we're starting to open things up. Large events make R bigger. Being in densely populated areas, being close to people, make R bigger. And so that 6-foot distance is a way of keeping R smaller. That's another way to think about it. And so being, again, as things slowly start opening up again, I think a lot of the public health advice will be around trying to keep R lower. And as long as R is lower, even though we still have transmission and we still have illnesses and deaths that are tragic, the thing we really want to try to avoid is overwhelming our healthcare system and having more people who need ventilators than we have ventilators and all of that. That is something that we just can't allow to happen again in this country. That's so tragic. And of course, the ventilator does not necessarily save your life. So even having a ventilator is not an assurance that you're going to survive once you're that sick from this virus.
Governor Cuomo was saying that 80% of those who get a ventilator die. That once you're sick enough to need a ventilator, it's very hard to save you even if they have a ventilator for you. So let's.
Why we need new medicines? Yes. It's so important.
And let's go on to another question. Don, who do we have?
We've got Tyler from Tarzana. Tyler, you're on.
Hi there. Thanks for taking the call. So this is related to PUA and PPP. So I'm helping a lot of independent contractors who are self-employed walk through the process. But what they're finding is that on the application for PPP, it's saying that by accepting this loan, there may be a consequence as it relates to the PUA. But I'm not able to find what that consequence could be, or basically how to navigate the choice between PPP and PUA as an independent contractor that's self-employed with no employees.
I wish I had answers for you. Certainly the unemployment insurance is a lot simpler and doesn't involve risk. The PPP, you get the loan, then you have to prove that you met all the requirements, and then it's forgiven. The unemployment insurance, you get the unemployment insurance. You don't have to prove that you get to keep it. We have this segment of the economy. Our laws were based on the idea that you have the factory and you have the employees. And all of our laws are based on that model. And yet, we now have, to some extent, a gig economy, or the one-man or one-woman business. And so I do know that it was the intention of Congress that nobody gets a PPP and is able to pay themselves with that and also gets the unemployment insurance. Whether there's a loophole that benefits one of your clients and allows them to get both, I don't know. And I hope not, unless they live in my district, in which case maybe I'm rooting for. And let's break this: if people anywhere are getting 2 scoops of ice cream, it should be in the valley. But clearly, the intention was that you shouldn't be able to get both. Whether the law is really written that way, or whether there's loopholes in it, time will tell. But I think if the federal government's efficient, your clients will not be able to get both. And which of the two is better depends. Keep in mind that PPP is only an 8-week program. Whether it gets extended or not, I guess it would be extended, but predicting what happens in a negotiation is very difficult. Whereas the unemployment insurance is longer term. So which of the two is better for which of your clients? That's why your clients are paying you. I want to go on to a third survey question. This is question C. Should the IRS disperse a second time the $1,200 per adult, $500 per child economic impact payment? Should we do it again, knowing that that's going to run up the federal deficit by on the order of $500 billion? Should we do a second $1,200/$500 payment? Push 1 for yes, 2 for no, 3 for unsure, and let's go to another question from our audience.
Okay, we have Maury from Encino. Maury, you are on.
Maury, are you there?
I'm here.
There you go. You're on.
Mm-hmm.
Okay. Assuming that we know that China is culpable, whether it be by accident or by design, as to the release of the virus, and they didn't do anything about warning the world or us or anybody, what are the options that the United States really has in making China pay without hurting ourselves from an economic standpoint as well?
Dr. Fauci has, and I think the scientific community has determined, and Dr. Goldman, interrupt me if I'm wrong, that this virus was not synthetically made, that this evolved in bats and other animals and jumped to human beings. Now, did it jump at a wet market in China? Did it jump at a lab in China? There is a feeling that if it jumped at the lab, that shows a greater level of negligence by the Chinese government. I think so, although the idea of bringing in live bats and having them mix with other exotic animals and then slaughtering them in front of patrons so that they can go home and eat, that doesn't sound like an incredibly healthy or safe thing for a country to allow. The lab was trying to do good work. Believe it or not, there was on the order of $1 million of U.S. government money that went to that lab, and yet that lab was not as safe as it should be. And a number of scientists have said, here are all the protections that exist at a level 4 facility. With all those protections, this couldn't have jumped to human beings and infected human beings in the lab. On the other hand, there's a State Department, I mean, this is unusual. I mean, State Department science experts, and they're not, the State Department doesn't have the level of scientists that we have in, like, the NIH, but State Department science people visited this lab in 2018 and wrote a report saying, well, you know, all those safeguards you expect at a level 4 facility, they're not all here. So China would be ultra culpable if this was deliberate, pretty damn culpable if this was an accident at a bioweapons laboratory. Accident but bioweapons is a pretty terrible combination. China is to some degree negligent, whether it was the lab or the wet market, but I think that the world would look at the lab as a higher level of negligence. Then what do? There is in our law a sovereign immunity that prevents Americans from suing a foreign government for what they do. And likewise, the U.S. government, you know, it's not like somebody is suing us in a trial in Hanoi for the Vietnam War, which you can argue we were trying to help the Vietnamese. You know, you can argue the Vietnam War all you want, but the fact is a court in Hanoi would probably say that we did the wrong thing. I do not think that there is a way to hold China accountable without a major disruption in the trade relationship. If that were to happen, the U.S. government does owe the Chinese trillions. Some of that is on deposit by the Chinese at the Federal Reserve. If we were in economic war, I don't think that money would be paid. But right now, the whole world has to work together to eradicate the disease. We need as much information as we can get from China, and a lot of that PPE is coming from China. But there will come a time when we need to determine either how this disease developed, and or determine that we can't determine because China is not forthcoming with the information, as they have not been. They scrubbed that wet market down in a way that scientists cannot go back and determine whether that is the source. They have imprisoned doctors who were concerned about the lab. So the strongest evidence of Chinese culpability is Chinese obfuscation and opaqueness. But where we go from here, I don't know. This does not, again, though, appear to be either a weapons program gone wrong or a deliberate attack on their own people in the world. We have the answer to the third question. Somewhat similar to the last two in our answers. This is about the additional stimulus disbursements. Yes, 61%. No, 19%. Undecided, 20%. Doctor, perhaps you could tell us about the two treatments that are being discussed most, hydroxychloroquine and remdesivir. Which of these shows promise, and is the promise enough to change our view that this is still a very deadly disease?
Well, that's very interesting. We have two drugs that are actually now, under study. One of which, the hydroxychloroquine, has been in use for a number of years for many diseases, malaria, for certain parasitic worms, for autoimmune diseases, but is also well known to have a lot of safety issues. through all the years that it's been used. And then the second one, remdesivir, which is a fairly new, very specifically antivirus drug, which was being tested most recently for Ebola, and it seems to have some very specific effects in terms of attacking the particular kind of virus that in fact the COVID virus is, which is that it's an RNA virus. For an RNA virus to replicate itself, there's a special enzyme that it has that allows it to first make something that looks like a DNA, so that our cells are fooled into making RNA for the virus. And so that's something that we don't have. We don't have to have a reversal for human cells to reproduce themselves. We just make our RNA from DNA. And so the great thing about an antiviral like remdesivir is that it's not going to have the same kind of negative effects, toxic effects potentially on human cells. However, it is very early on in terms of it's being studied. It does wonders in a petri dish. It kills these viruses like crazy. It has worked very well in animal studies. In human studies, it's showing some positive effect, and it's making us feel that either this drug or other drugs from this family are going to be very effective. The hydroxychloroquine, on the other hand, the studies so far haven't been impressive in terms of showing effect. There were some early studies out of France that seemed to show effect that were very uncontrolled, were not well conducted, and better conducted studies that are being done now are raising more concerns about toxicity. Now, granted, the toxicity is among people who are very sick or they're older people, but those are the people we're most worried about. And so it could well be that the toxic effects of that drug are going to make it less useful generally for the very people whose lives we're trying to save, which is those who become very ill from the infection. So I think I'm hopeful that either this remdesivir or other antiviral drugs will end up showing effects, but the researchers have to fool around now with things like the dosage, how much to give people. Maybe the doses haven't been high enough, some people have been suggesting, and also the way that they're administered, and which is, it's kind of reminding me the early days of HIV/AIDS, when we started to see effects of some of the drugs, and then it turned out that we could come up with antiviral drugs that would, if not cure the disease, in the case of AIDS, suppress it.
And these drugs are, to some extent, we're relying on animal studies, and one line from Dr. Goldman's world is that mice lie and monkeys exaggerate. So we're going to have to rely on human studies to really know how effective and at what dosage.
We're trying to encourage the FDA to reduce some of the paperwork, not the safety studies, and certainly not the rigor of having really scientific studies so we can be sure that if we see an effect, it's a real effect. But some of the paperwork and some of the other processes that can very much slow things down. We're in the middle of a global pandemic. This is an emergency, and so we're trying to encourage the FDA to move as quickly as possible with these newer drugs.
I mean, just as simple as determining whether a particular Chinese 95 mask meets U.S. specifications. You don't have to be a rocket scientist just to look at the mask. Has really slowed down the FDA, different departments than the one that Dr. Goldman's dealing with, but they've been slow. Folks,
I agree.
We're going to take one last question before we do. If you're having a problem dealing with any of the federal programs, you're going to want to call our office, or better yet, contact us through the website. The website is bradsherman.house.gov. You'll see where to click for constituent service. and the phone number is 818-501-9200. I know that that office is directed by our district director, Scott Abrams, who's on the line, and whose wife, thank God, recovered from COVID-19, and Scott and the family are doing well, and talk about being careful. Scott didn't get the disease. I want to point out that in all likelihood, we will do this again at 7 p.m. on May 19th. Again, you can, to be sure, to RSVP and to propose a written question. And I just realized we have not taken sufficient written questions. So our last question will be one from someone who RSVP'd. You can go to bradsherman.house.gov. The dial-in number on May 19th, we're almost certain to have it, to have the town hall at that time, is 877-229-8493. The PIN number is 13402. And it's only fair that we take one of the questions from someone who sent one in. We've got Chevron from Bell Canyon, who asks, what are we doing to ensure that Wall Street-backed firms are not able to access PPP that are intended for small and cash-strapped businesses? I should point out that that Democrats fought for this, and it slowed down the bill that was adopted most recently, that a reserved chunk of the money for the PPP program go to the smallest financial institutions that have the smallest businesses as their customers. We were successful in that. We've used public pressure to deal with Ruth Chris Steakhouse, the Lakers, situations like that. The bill, and it's hard to see how to apply this, because the bill originally said we'll have a special rule for restaurants that will only count the employees per location rather than for the whole company. But let's face it, Ruth Chris Steakhouse is not a small business, notwithstanding they have less than 500 employees at any one restaurant. We are fighting. I've joined with Congressman Schiff in introducing legislation to establish a commission on this pandemic so that we can look at how this money is being spent and how our country responded to the COVID-19 pandemic in the same way that we looked with the 9/11 Commission on what happened there. And in the CARES Act, we have provided for inspector generals to look at the process. But we certainly do not want this money going to big firms or to firms that don't need it. With that, we're 2 minutes over time, and our vendor will get upset if I keep you on the phone any longer. I want to thank everyone for participating in this telephone town hall. Look forward to being with you again, most probably on May 19th. And I especially want to thank Assemblywoman Christy Smith and Dr. Lynn Goldman for joining us as our guests. Thank you very much. This is Congressman Brad Sherman.